Hi everyone, welcome to week number 9. This week is really helping us hit that home stretch, so we only have a couple of weeks left here in this quarter, and then you'll get a nice, wonderful break. This week, Module 9 is really talking about the patient interview. So that's going to look at chapter 36, pages 798 to 804. Okay? So when we talk about a patient interview, it's really not a job interview like you would think it would be. It's essentially how the medical assistant gets that patient ready for the provider. Okay, it's the health history forms that we have them fill out and the questions we ask them that help the provider get a better understanding of the patient's health status and their current condition. Now, sometimes you may work in a facility that will send a patient a form either by mail or by email and have them complete that prior to their visit. But when they actually come into the office, you're going to hold that interview still because you're going to ask some more additional in-depth questions. What you're going to ask them is things like their chief complaint. You're going to ask about present illness and past illnesses or past medical history. You're going to ask about family medical history. You're going to ask about social history. And there's going to be an assessment of the body systems. So let's talk about each of these individually. So when we talk about a chief complaint, that's really the main reason the patient's there. What brought them into the office today? What is the problem that made them want to come see the doctor? A chief complaint is made up of signs and symptoms. So it's important that you as a medical assistant understand the difference between a sign and a symptom. So signs are objective. What that means is that you as medical assistants and other people can actually physically see the sign, the symptom, the problem. You can see it. You could feel it. You could touch it. All of those things. A symptom, on the other hand, is subjective. That means only the patient can really feel it. We can't see it. We can't feel it. We can't touch it. Only the patient can really feel those things. So the one I like to use, a great example, dizziness. I can't see dizziness in a patient. I can't touch dizziness in a patient, but the patient feels it, right? That's a good difference between a sign and a symptom. It's also important that when you're taking a chief complaint, you ask questions where the patients have to physically give you an answer. Those questions generally are going to start with a what, when, where, how, other than just saying, do you, because then it's just a yes or no, where they actually have to give an explanation, helps the provider be able to give them the best care possible. Now, a present illness is very similar to a chief complaint. Essentially what it is just a more in-depth understanding of that chief complaint. It's going to give detailed information such as, onset, duration, and intensity. So when did it start? How long has it been going on? And how bad is it? Pain scale of 1 to 10, how bad is it, kind of stuff. Past medical history is we're really going to look at all the diseases or medical problems this patient's had from the past to at that moment that they come into the doctor's office. Okay? This could include things such as childhood illnesses. It can include major illnesses or injuries, any hospitalizations or surgeries they've had. It's going to look at any allergies to medications, and it's also going to look at the current medication as well as the former medications they've taken, including any over-the-counter medication. And it's also going to look at when that last physical examination was and their immunizations that they had as children. We want to make sure that they're up to date with all of their injections that they should have. Family medical history is where we really look at blood relatives of the patient. So those could be things like mom, dad, brother, sister, grandma, grandpa, aunts, uncles, okay? Now, more commonly, we want just that immediate family, mom, dad, brother, sisters. Unless, of course, you've got an aunt or an uncle or a grandma or grandpa who have a serious medical condition that could be passed on to you. High blood pressure, diabetes, cancer, hypothyroidism, anything like that that could be passed on to you as the patient, we would want to know about that. And then the last piece is really going to be social history. This is the last piece that you as the medical assistant will be responsible for obtaining. When we talk about social history, what we're really looking at is the patient's lifestyle. So we're looking at, do they smoke? Do they drink? Do they use any recreational drugs? What's their occupation? What's their marital status? What's their sexual preference? Diet and exercise, where are they at with that? And their sleeping habits. All of those will play a very large role in the patient's health, so it's important that the doctors know everything that they need to, even if some of those things are very uncomfortable to talk about. Okay? And then that last piece, that assessment of the body systems or review of systems, is really done by the provider. What he's going to do or she will do is really just a head-to-toe check of all of the body systems, making sure everything is functioning correctly and properly. All right, guys, so that's kind of all I have for you this week in the video. Because it is only just a few pages, I really want you to read that chapter prior to coming to class on Wednesday, because it's going to help you for the lab activity that will be taking place. So what I mean by that is you are actually going to be doing patient interviews. Okay? I'm going to set up a mock exam room, and what you'll do is you as the medical assistant will actually physically walk through doing a patient interview, a mock interview. I will be grading you on your listening skills to your patient, about how you complete the history form, how you document the visit. I'm also going to grade you on how you keep up the record of their medication or their immunizations, depending on what scenario I give your patient. Now, patients, I will give everyone a scenario with the reason for visit and all of the information that you will need to make this mock interview as real as possible. Okay? I'm going to provide everything that you're going to need form-wise, and I will also provide everything that you're going to need patient-wise. So please make sure that you are on time to class, because this is going to take up a big majority of our class this week. Also, there's no discussion post this week, so I'm sure you're trying to figure out how this is all going to work. If I'm working with people individually, what are the rest of you going to be doing? So this week, there's going to be an in-class activity. Going back to looking at some charting like we did last week in class. So while I'm working with those patient interviews, the rest of you will be working on those charting exercises, which are actually your discussion post and your written assignment together in one. That's right. No discussion post on Tuesday, no responses on Saturday, no written assignment on Sunday. Your charting activity that you will do in class should be done by the end of class, and it will be your homework, your discussion, all of that in one. That means outside of class this week, you should have nothing due for me. Okay? It's kind of nice to have in the home stretch of this course is to have nothing to do on Module 9. Please, please, please make sure that you bring all of your equipment to class. What I mean is you are going to be an actual medical assistant this week. So you need your blood pressure cuff, you need your stethoscope, you need your uniform, you need your watch, you need everything that you would need if you were going into an actual medical office, okay? If you don't have it, I don't know what to tell you, because I'm taking away the clock this week, so you won't have anything to stare at. So please make sure that you come prepared to class this week. All right, guys, have a wonderful week, and I will see you on Wednesday.